Assalamu alaikum, dear students. This is your physics teacher, Sahiba Irshad. As you all know, there won't be classwork for some days, so we'll be resuming the previous classes that we were going through. That is the human eye and the colorful world. We'll be going through some virtual classes. I have presented some PPTs, so kindly try to focus. Now, till now, we have discussed the human eye. It's the layers of eyes, including the choroid, sclera, the different hyperpigmented layers inside the retina. So, there and the structure and working of the human eye. But after this, we'll be discussing some more features of that a human eye can do. It can actually do wonders. And what wonders it can do is that it can actually focus the light coming from the far objects as well as the near objects, which is somehow a magic because this is the ability of an eye to see things that are far and closer. So for this, we'll be going through the topic that is the power of accommodation. What is this power of accommodation? Power is obviously something having a power to do something, and our eyes do have a power. And what power does it have? It has a power of accommodating the light rays coming from the objects that are at a distance from it, as well as the objects that are closer to it. So, what does the eye actually do when the objects are at a distance and are closer to the eye? Let us see. First of all, let's go for the objects that are farther from the eyes. Say our object is somewhere far, say at infinity, and I already told you that infinity is not that infinity, it is some real number in physics. So, from light rays, when the light rays are coming from infinity, the light is being converged by the by the convex lens inside our eyes on the focus that is made on the retina, and we can see the images. What is the condition of the ciliary muscles at that time? Say these are the ciliary muscles, the red portion. When the light rays are coming from the distant objects, the ciliary muscles of the eyes are relaxed. And due to the relaxation of the ciliary muscles, they will not contract the convex lenses, because it is a job of the ciliary muscles to contract the convex lens inside our eyes, even elongated. But right now, when the light is coming from the farther point, there is no contraction in the convex lens and the ciliary muscles are relaxed. So, due to the relaxation of the ciliary muscles, our focal length is greater. And what is this focal length? Focal length is the, say, this is a lens, this is the optical center, and there is some focus here. Light rays coming are being converged at this focus. This distance from the optical center to the focus is known as the focal length. And when the convex lens is relaxed, what is the condition of this focal length? The focal length is greater. So I'll be denoting focal length with FL. Focal length is greater. While I was talking about the converging power is to converge the light rays. The light rays are already coming from the distance. You can see the parallel beams of light. They are being directly converged on the focus. Though the eye lens is not using any greater power for converging, since the curvature of the lens is not greater, the focal length is greater. The converging power, I'll denote the converging power with a CP, the converging power is lesser. Repeating again, when the objects are placed at a distance from the eyes, the focal length is greater and the converging power is lesser. What is this greater focal length? That is, the distance between the optical center and the focus is greater because our lenses are relaxed that time, the ciliary muscles The ciliary muscles are relaxed that time, so the light is being focused on the retina directly. Okay, this was about the objects at distance. Now we'll discuss when the objects are closer to our eyes, that is, the objects are at a near distance to our eyes. Say the convex lens inside, these are the ciliary muscles. Now when the object is placed closer to the eye, say somewhere here, the light rays are coming from the objects. This time the ciliary muscles tries to compress this eye lens, the convex eye lens, because the light rays seem to diverge. So it has to use a lot of power. The lens has to use a lot of power to make a focus on the retina, because it has to converge the light on the retina, so it has to use greater power to converge these light rays on the retina. Okay, so talking about the objects when they are near to the eyes, for normal eyes, what the ciliary muscles do, they compress the eye lens. Due to the compression of the eye lens, what happens, the focal length is smaller comparatively to the to the condition of the eye lens when the object was at a greater distance. This time the focal length has become smaller, so we can say that for the when the objects are closer to our eyes, the focal length has to be decreased, and the curvature of the lens, that is, curvature is this portion. Okay, the curvature has to be increased by the ciliary muscles, and due to the increasing curvature, there is an increase in the converging power. So we'll say for this condition, the focal length FL is less and converging power CP is great. Okay, you get it? So this was about the power of accommodation. So this is the condition I have been showing you for the far point, that is the object as a far distance. So this is known as a far point, and the far point is taken to be as infinity. This time the lens is relaxed. If you can see in the first portion, here, here, the lens is relaxed, and in the second portion, the lens has been expanded by the ciliary muscles, because the object is near, so it has to make a focus on the retina, it has to use a greater converging power. Fine. Let's move to the next slide. So this is the about the range of the vision. What is the range of the vision? That I already told. When the farthest point, it is the farthest point with which an object can be seen, is known as a far point. When the object is farther from our eyes, it is the far point of that object. So the far point is taken as infinity, which can be some real number, and the eye has to focus on the objects, and the ciliary muscles are actually relaxed, and we have a less converging power and a greater focal length. Kindly remember this. While as the talking about the nearest object, the near point is always taken as 25 centimeters for the normal human eyes, without any defect, because human eyes can have certain defects, which will be dealing in the next slide. When the eye focuses on the nearby objects, the curvature is greater, as I already told you, because the ciliary muscles have to expand these lenses so that they can converge the light rays directly on the retina, and due to which the focal length is smaller and has to use greater converging power. Now, humans are normal, humans can be defected, so we have defected eyes, some of us, known as, and there are certain defects of human eyes which will be dealing one by one. The first type of defect we'll be going through is the myopia, that is a short sightedness. And in this kind of defect, the human eyes can actually see the objects that are closer, but they cannot focus on the objects that are farther from, that is a far point. They cannot focus on the far point. The things appear blurred, like most of us has myopia because we cannot see the blackboard when we are sitting at the last bench. We cannot focus, the things seem blurry on the board. So what we do is we are being prescribed for lenses by the doctors. We can correct these defects. There are certain ways which we'll be dealing again. See in the right side of the picture, for the myopic eyes, the farther objects are a little blurry, while as the person who is closer to you appears to be clear to you, isn't it? So this is the condition of myopia. And why does this myopic, what happens when a person has myopia? In the condition of myopia, if you can see, the first eye is a normal eye, but the next eye, if you see that the next eye is a little bit elongated. In condition of myopia, the eyeball of a human eye gets elongated. Even the cornea gets a little stretched due to certain reasons. The elongation of the eye happens, and in fact the curvature also increases. The curvature also increases. So what happens due to the elongation? I'll be telling you. For example, this is a normal eye. As we are dealing with myopia, the distant objects are not clear, so light rays are coming from some distance. It is focused on the retina directly. This is for the normal eye, but for the myopic eye, what happens? The eye is a little elongated. See, like this. Due to the elongation of the eye, the retina should have been here, but actually it is not here. The retina was supposed to be at this point, but now due to the elongation it is here. So what happens? When the light rays come from the farther objects, instead of getting focused on the retina, they are actually focused here, because the eye is being elongated. So the light is being focused in front of the retina in case of the defect myopia. That is also called as the short sightedness. There can be certain corrections for the myopic eyes. And how do we correct this defect? This defect can be corrected by using a concave lens in front of our natural lens, natural crystalline lens, that is in that we use in our spectacles. What is, see, actually the light rays are being focused in front of the retina, so we want to diverge this light ray a little away from here. See, we want to diverge this light ray a little away so that it can be focused actually on the retina. So what do? We wear concave lenses in our spectacles, because concave lenses are the converging lenses. See, what do we do? Oh, sorry. Use a concave lens. Concave lenses are converging lenses, and we have a natural crystalline lens inside. So the light rays coming, they will seem to diverge a little, but then we finally focused here. Okay, but actually light, your focus point in myopia is here, but light is actually diverged at this point in the elongated eye here. Okay, because of the concave lens, because concave lens is trying to diverge this ray a little farther. That is why we are using concave lenses in case we have a defect of myopia. Okay. Now, similarly, we have one more defect in our vision known as the hypermetropia, and hypermetropia is also known as farsightedness. And what is this farsightedness? In this kind of defect, the eyes can focus on the far objects clearly but cannot focus on the nearby objects clearly. And a person who has hypermetropia, his eyeball is little shrinked. Like in case of myopia, we had elongated eyeballs. In hypermetropia, we have shrunken eyeballs. That is why what happens, I'll be showing you. See, in case of hypermetropia, the image is being formed behind the retina. What happens in this case? See, now we can take a normal human eye like this, which is being focusing the light rays directly on the retina. Since we can't see the nearby objects, we'll be passing the light from the nearby objects like this on the retina. This is the normal human eye. But in case of a defected eye, our eyeball is a little shrunken than the normal. The actual ray, the actual size should have been this, but now it has been shrunken. See what happens. The eye supposes that the retina was here. In case of the defect, this is a defected eye. In case of the defect, the eye supposes that the retina is here. That is why the light rays are being focused behind the retina, क्योंकि जो आँख है उसका एक्चुअल फोकस जो है इट शुड हैव बीन ऑन दिस पॉइंट, लेकिन ड्यू टू द श्रंकन आई वो आगे को आ गया है, आपका रेटिना आगे आ गया है. तो जो द आई इज ट्राइंग टू कन्वर्ज द लाइट रे एट द एक्चुअल पोजिशन विच वॉज हेयर. दैट इज वाई द इमेज इज being formed behind the retina. I hope you got it. So, like we had corrected the defect of the myopic eyes, we can also correct this hypermetropic eye by using a convex lens, which you can see here. This is a convex lens. Since the light rays are being formed behind the retina, we want to just bring them forth at the fourth position. Bring them like I'll I'll show you how. This is a hypermetropic eye. Okay, what we will do, we'll put a concave, sorry, a convex lens in front of the eye, because convex lenses are converging lenses and we want to converge the light ray, because the light rays were actually, you can see the light is actually being focused behind the retina, but we want to focus them somewhere at this spot. So we want to bring this light towards the front position on the retina, exactly on the retina. So it will create a hypothetical situation so that we can see the correct images. We will use a convex lens. So the light rays are being converged on the retina. We'll use a convex lens. It will try to converge the light ray a little towards the lens, and the lens will further converge the light ray on the retina. Okay, So this is the defect which can be corrected by using a convex lens. So remember, in myopic eyes we have used a concave lens to correct the defect, but in case of hypermetropia or the farsightedness, we'll be using a convex lens so that we can convert the light rays on the retina, since the image is being actually formed behind the retina. So we can focus them exactly on the retina because the eye has been shrunken. So this was all about the hypermetropia. Next situation is the presbyopia. What is this presbyopia? This defect is related to the age, and this happens usually when you are at an age of 40. So this defect can be caused at the age of 40, known as a presbyopia. What happens? The person having a presbyopia problem cannot focus on the nearby objects. They can get these blurred visions of the objects at the which are at the near point. So what? Before earlier times, it was being corrected using a bifocal length. That is, it was having two kinds of lenses, even a concave lens and the convex, to focus both on the distant objects and the nearby objects. But nowadays, these can be corrected using the surgical methods, like corneal transplantations can be done. Wearing lenses and glasses are like the old traditional ways of the correction. So presbyopia is one of the defects. One more kind of the defect is the glaucoma, which happens in the diabetic patients. The protein levels inside the eyes are being increased, and the increased protein levels causes these spots inside the eyes, leading to the defected eye, and it can cause an impairment of the vision in the later stages as well. So astigmatism is one more kind of the defect. In this kind of you can actually see, the first is the normal eye. The light rays are being traveled inside the eye and being focused normally on the retina. But in case of astigmatism, what do people have? Their cornea is imperfect in shape. The cornea or the lens has some problem in the shape. If the cornea has a problem, what happens? The light rays, when it gets refracted on the cornea, instead of going in the instead of going in the straight way that was in the normal vision, it takes the other way and is being focused on some other place on the retina. This causes a distorted formation of the image, that is a very, very blur image in case of astigmatism. So uh, 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 this was all about the different defects: astigmatism, presbyopia, hypermetropia, myopia, their correction, and the range of visions with the accommodation of the eye. So this was all about this. These topics. We'll be discussing the further topics in the next videos. Thank you so much.